Now, the AU COVID-19 Commission has received a tremendous boost. It's received thousands of dollars in funding from the Serum Institute of India. The Commission is trying to implement its mandate to establish an AU health workforce task team. Let's discuss these developments now with Dr. Kuchini Gutahi, the Group Chief Executive at AMREF Health Africa and the leader of the African Recovery Working Group of COVID-19 Commission. Thank you very much, Doc, for your time here on All Angles. Forgive me if I probably mispronounced your name here and there, but just give me details as to how much is this boost firstly and where will it go?
Thank you very much, Masao, and thank you. You don't worry about my name. I can't pronounce your second name, actually. So we are equal. And the Africa COVID-19 Commission has received $2.5 million, which is more than 42 million South African rand. And this is for supporting the development of what we call the Africa Union Health Workforce Task Team, which is an initiative of the Africa COVID-19 Commission, which is, of course, chaired by the South African President, President Cyril Ramaphosa, on appointment of Africa Union as the COVID-19 champion for the continent. So this is a huge boost to this activity of establishing an Africa Union Health Workforce Task Team.
Remember at some point, there was a lot of pleading from our leaders, including the South African government, Cyril Ramaphosa, in terms of going to international countries and practically begging them, really, as the African continent, to remove patency on their COVID-19 vaccinations, etc. And Africa is fighting to be able to also, have facilities where we can produce our own vaccines. So is this a step possibly in that direction as well?
Well, yes, I would say that. The first thing to say is that Africa already does manufacture vaccines. You're aware, Masego, that Aspen does produce vaccines currently. We have also other plants that produce vaccines in some other countries like Senegal and North Africa. So we do produce vaccines. The issue is that we don't produce adequate volumes of vaccines. 99% of all vaccines that are used in the continent are imported. And this largely reflects not only the COVID-19 vaccines, but also our childhood vaccines. Why so? There are many factors. And of course, some of them include capital, market shaping to ensure that the market, when the vaccines are manufactured, they have a market where they are purchased and delivered for people and to save people's lives. But there is also the intellectual property you refer to, which South Africa and India has been pushing with the World Trade Organization for a waiver of the intellectual property rights so that we can expand manufacturing and access to technology for manufacturing vaccines in Africa and elsewhere. But finally, is the issue of the health workforce, that for you to manufacture vaccines, you need trained, specialized experts to take care of the safety, the development, and also the vaccination programs. So this will also enable Africa on this local manufacturing of vaccines and other commodities agenda. In addition to ensuring we have the right workforce to respond to any health threat, current and in future, to respond to the needs of the continent, to establish universal health coverage, basically what we are calling developing a fit-for-purpose health workforce, which ensures economic recovery, social recovery, and global health security for this continent.
We have an NHI that, our government has been trying to get into South Africa. It's failed quite a couple of times and it's not actually happening. It's the National Health Insurance. And of course, this has to do with universal health, also for the African continent. So I understand that this boost from the Serum Institute of India will help us make sure also, Doc, because just because you have a universal health fund, etc., as the African continent, what's important is the quality of the health that is offered to the people. So this boost will assist with that?
Yes, it will. You see, what we are looking at post-COVID-19 and during this pandemic is that we have noticed that the protection of social and economic development is based on a healthy community. Health is a protector of social and economic development. But the most important element of health services and health provision in terms of access and quality is the software of the health system. And that software is health workers. I saw a video of you, Mr. Sego, going out to the community in South Africa with a nurse, trying to see essential workers, how they work, the dangers they go through. We know that without a well-resourced health workforce, we cannot protect the social and economic development of this continent. So we are saying that even as you look at the National Health Insurance of South Africa, National Health Insurance Fund in Kenya, and many other countries that are developing this, they are looking at financing and accessible financing. But financing is only one element of universal health coverage. The other elements have to do with access, where, when needed for optimal outcome, and the quality of that service, so that you have optimal outcome. If you have a mother with a pregnancy, you want the outcome to be a healthy mother and a healthy child. And that is determined largely by the skilled health workforce who then offer the services to that individual. So yes, the Africa Union Health Workforce Task Team, which is going to work through, number one, ensuring that we develop mapping of needs across the continent, working with national governments, developing a good compendium of the needs across the continent, drafting what we are calling a compact, which is going to be signed between the Commission, the Africa CDC, and each of the countries, and then starting slowly to develop training curriculums, including digital development, compassionate care, to ensure that we improve the quality of service delivery, which is then supported by the financing initiatives, delivers a much better, robust health service delivery that ensures that we have a healthy continent. And a healthy continent is a healthy globe, because international security depends on health at every community, every region, and every continent.
And a healthy continent also means a healthy economy. Thank you very much for speaking to us, Doc. That was Dr. Kitinji Gitahi, the Group Chief Executive Officer at AMREF Health Africa and the leader of the African Recovery Working Group of the COVID-19 Commission, coming to us live from Nairobi in Kenya.